Hi everyone, welcome back to my channel. My name is Anthony. I'm a licensed acupuncturist, a personal trainer, and a holistic nutrition coach based in New York. Today I want to share with you my experience with trauma or orthopedic medicine, which is a subset of Chinese medicine. And it's my personal experience with an injury that happened to me yesterday, sparring with my training partner. And my toe was jammed and it was quite painful that I couldn't continue training, and I treated myself right after, and now 24 hours later my toe got a lot better and I'm going back to train. It's a personal choice and judgment based on how I feel now. I'm not guaranteed that everyone has a acute injury like mine will recover overnight like this, but it is a possibility. And the message I do want to share is that the sooner you treat an injury, the better and the easier it is for the body to heal. And I've noticed from my experience living in New York for over 20 years is that culturally we're not conditioned or learn to take care of our acute injury or situations proactively for many reasons, which we don't have to go further into. But when I was a young child in Hong Kong, while I was a young boy, I remember my first encounter with the medicine was from playing soccer and sprained my ankle. And I was told by my parents, always to take care of your injury immediately, so that later on in life you don't develop arthritis. So it's a common knowledge in Hong Kong, where I was from, that treating injury as soon as possible, it's much more effective in further a long-term or suffer a long-term consequence to a small injury. So the earlier we treat it, the better. As a matter of fact, at the time I was really fascinated by these orthopedic doctors. We call them the falling and hitting. In Cantonese term is tita, doctor. Falling and hitting is the translation of tita. And I was really fascinated by the way they work. They do a lot of work manually with the joint, and they put like herbal poultices, and they really understand the small detail by feel and touch of our joint. So I was really fascinated by how they work, and I just had no idea where you could learn it from. I thought it's more like a tradition of like father pass it to son, which is actually common practice back in the days. But now I think there is other avenue of learning, with which is learning from the School of Chinese Medicine or learning from different masters. So in the following videos, you'll be able to see how I apply the idea and principle of Chinese medicine and some modality in Chinese medicine in treating myself. I hope you enjoyed the video, and I'll see you next time. There's inflammation around the joints. That's how our body responds to injury. So to aid injury recovery, we can facilitate as practitioner, not to encourage anyone to do it by themselves at home without the understanding of injury and also the tools that I'm gonna be using. But I'm just gonna show some of the common tools or modality that a Chinese medicine practitioner knows how to utilize in acute injury situation. So for my injury, based on my assessment earlier, I figure I would use the 3 modality. I'll use acupuncture needle, maybe a lancet for letting this purple blood vessel go, and also using the herbal liniment that I make, and also some moxa, the burning of the mugwort plant topically to reduce inflammation. So it will look something like this. So now I just needle myself with the intention to repair the local injury area based on the pathway and the functionality of the acupuncture point that I just used. So I'm just gonna rest and relax for a bit, and then I'll show you the next step and my thing. And now I'm just gonna use a lancet to let those purple blood vessels go. And practitioners should be practicing clean needle technique in the clinic. So, draw, feel blood here. Find the darkest vessels to go for. That one's pretty good. Let's see. So now I'm just going to needle the only point of the tendomuscular, or we call the sinew channel in Chinese medicine. So this is creating a pathway for, we call it the external pathogenic factor to go out of the body. You can think of just like when you have a buildup of any sort of like fluids, right? You want a path to let it go. And the metaphor in Chinese medicine is like, this is the well, and there is the ocean, the sea, the stream, the river, and you're allowing that flow to have a point of release. So I'm just gonna put it right here, and to activate the meridian, just like that. And I'm just gonna leave it here. Okay, I just activated that acupuncture point, and I took out the needles. And lastly, I'm going to use this herbal liniment that I make for any sort of acute injury. And I'm just gonna apply it on my toe and let it get deep into the layers, and really let it just get into the tissue. I'm mindful of where I have my bloodletting locations are, and I'm going around it. I'm not going on top of it. But sometimes I just use my hand to massage into it, but I don't want to get my hand smell like herbs right now, so I'm just using a Q-tip. I still feel some pain here, so it's not fully gone, but this should get better, and I'll give it a little bit of time. So right here, I feel a little bit of pain, and I am moving this to push the fluids out. So this has been about 18 hours since my last treatment for myself, for my big toe injury that happened yesterday. As you can see, there's still a little bit of purple over here. There's actually a darker purple. So the more acute swelling is gone down quite a bit,
and there is almost zero, actually there is no pain to the touch right now. Even if I press really hard around here, there is like a 1 out of 10 pain, but it's barely noticeable. So I'll continue to use this herbal liniment in the next few days to help the area to dissipate any swelling that might come up and to stop the pain. And that should be all good for my toe. And now I can actually flex my toe a little bit, and there is, like I said, maybe like a 1 out of 10 pain. It still feel a little stiff, but this will get resolved over time. When there's swelling, your joint just doesn't want to or is not able to move. I hope you like this video. I'll see you next time. Thank you.